Thank you very much. Thank you, Steve, for that introduction, but much more than that, thank you for your countless hours of help and advice and counsel as we've tried to craft a healthcare reform plan that would really work for people. I'm also pleased to be here with Dr. Kevin Fickensure, your chairman of your board, and Diane Moeller, who I know is a dynamic president and chief executive officer. And I was just told that in your audience is Rick Pollack, the president of the American Hospital Association, with whom we have also been privileged to work, and Tim Eccles, who is representing the Catholic Health Association, another group that has been extremely helpful to us as we have tried to put together the many pieces of what a reformed healthcare system would look like and mean for our people. It is a pleasure for me to be here with you at your 14th annual spring conference. I wish I could be there in person rather than by this high-speed electronic highway, but at least we now have the opportunity for me to be in two places at once. I want to start by applauding you for your dedication to the ministry of healing and your commitment to assuring quality health care for all Americans. With your network of more than 110 facilities and 8,200 beds, you are serving people from all backgrounds in 11 states, and your mission is clear: to foster innovative and creative management of all resources with special preferences for the poor. That is a mission statement that I would like to see cover our entire healthcare system. Because of your important roles in our healthcare system, you appreciate more than most what is at stake in this discussion of reform that is currently going on in our nation. You know better than most the benefits we will reap if we do this right. You know better than most the terrible costs of doing nothing or only tinkering around the edges. Put simply, we are at one of those defining moments in history when we have an opportunity to make a real difference in the lives of the American people for generations to come. It is an opportunity we cannot afford to waste. The President's goal with healthcare reform is actually quite simple. He wants to provide a seamless system of care that provides health security for each and every one of us. That means guaranteed private insurance for all Americans, including comprehensive benefits that can never be taken away and that emphasize primary and preventive health care. It means giving Americans a real choice of health plans and doctors, unlike what happens today, where more and more of us are being told what doctors and what hospitals we can use. It means outlawing unfair insurance practices that drop coverage, cut benefits, increase rates if you get sick, use lifetime limits to stop people's coverage, and charge older people more than younger people. It means strengthening and improving Medicare by providing prescription drug coverage and long-term care options such as home health care and community-based care for older Americans and Americans with disabilities. And it means guaranteeing health benefits at work, the way most of us who are insured receive our benefits today. It also means making our system work better for doctors, nurses, and hospital administrators who toil every day, often against a mound of paperwork and regulatory interference to try to take care of us. It means building on the work being done in Ontario, Oregon, where Holy Rosary Medical Center reaches out to the uninsured, low-income women in their community to make sure they get the prenatal care they need to deliver healthy babies. It means building on the efforts of those of you from Park Rapids, Minnesota, where last year St. Joseph's Hospital worked with the county to immunize more than 600 mothers and children. It means spreading the same spirit of care and compassion of the health professionals at Mercy Hospital in Des Moines, who organized a bucket brigade to bring water to their patients when last year's huge flood shut off the water supply and power. Reform will build on these and many efforts like them by enhancing your ability to provide quality care to patients in need. As you know, many people who live in the small towns and rural communities across our country do not have access to our health care system and live lives of unnecessary anxiety and insecurity. Rural Americans are more likely to be uninsured, less likely to have access to a family physician or other primary care physician, and more likely to have to travel great distances to get to health care. Today, more than 8 million Americans living in rural areas, including the agricultural workers, have no health insurance to protect them against illness and injury. Many are people who work with heavy machinery and whose jobs subject them to great physical risk. A large number of rural Americans must buy insurance themselves, often at highly inflated prices. I recently met a young farmer from western Kansas who had charted out for me the number of bushels of wheat he must sell every year to insure his families. Just a few years ago, it was a couple hundred. Now it is more than 3,000, and there is no end in sight, which makes him believe that in a short time, his family will join the ranks of the uninsured. Even when a family has the means to buy insurance, the coverage is too often out of reach because of insurance company rules that deny coverage to people with pre-existing conditions. And you know, there are 81 million of us with pre-existing conditions in America today. For a farmer with a chronically bad back or a child with asthma, such prohibitions or increased costs are not just unfair, they are cruel and unjust. Compounding these problems, an estimated 34 million Americans live in areas that have been designated as medically underserved. More than 400,000 live in counties that don't have a single physician. For them, a medical emergency can quickly become a life-threatening catastrophe. Last year, I spent an afternoon talking with a family in Iowa that runs a dairy farm. Faced with a life-threatening illness, they chose to buy a very costly insurance policy rather than pass the financial burden onto the health care system. To raise the money they needed to pay their monthly premiums, they began selling their livestock. They literally had to sell their entire farm, one cow at a time. And I have met other dairy farmers in other parts of the country who ask me why it is that our government requires their cows to be vaccinated and have regular checkups when they cannot afford to do the same for their own children. So when I hear people say there isn't a health care crisis, I think about all the families I have met and talked with and heard stories from throughout this country. I just came from a meeting on the Hill with senators put on by an organization called Health Right, who represents chronically ill and Americans with disabilities of all ages. I heard the heroic stories of mothers and fathers struggling to take care of children, often born with a chronic illness or suffering an accident that created severe medical conditions. And I listened to them wonder why, when they need health care the most, they are put in such jeopardy, often forced into bankruptcy, required to sell their assets to qualify for government assistance, told they can't leave jobs if they're lucky enough to have insurance, or in the case of a young engineer whom I met, having to take a job that paid less than the amount of money that would qualify his family for medical assistance and never being able to take the raises he deserves to receive. Why do we do this to the least able to take care of themselves? Why do we do it to any of us? We must make insurance affordable to all Americans, and that includes rural America and underserved urban America. We must make sure that care is available, and that means recruiting and training our doctors and our nurses to provide incentives to them to set up practice in underserved medical communities. The President's approach to health care reform keeps rural America and the rest of underserved America squarely on the forefront of our agenda. It gives physicians and nurses tax credits if they agree to practice in an underserved community. It increases 5 times the National Health Service Corps, a program with a proven track record that should no longer be ignored. It offers seed money to expand the development of telecommunications and telemedicine to connect rural communities with regional referral centers. In short, the President's approach recognizes that rural America will not thrive unless rural Americans have affordable, high-quality health care they can really depend on. Despite what some critics and opponents of health care reform would have you believe, the President's approach is not a government-run system. It's not going to turn doctors into government employees. It's not going to put you into long waiting lines, all the scare tactics that the vested interests have thrown up to try to prevent real health care reform. It is not going to deny choice. In fact, it is going to increase choice and guarantee it. And it is not going to undermine Medicare, but make it financially stable and have it offer additional services that it should make available to citizens. It builds on the system we have, a system in which we get insurance through the workplace, but it makes that system stronger, fairer, and more affordable. Most important, it will make the 81 million Americans with pre-existing conditions always eligible for health care. It will relieve the 133 million Americans with lifetime limits in their insurance policies of worrying about when their benefits might run out. It will provide real health security throughout our lifetimes. That is what is at stake. I'm often asked why the President put health care reform on the forefront of the agenda. It's an issue that we've talked about and presidents have tried to make changes in for more than 60 years. It would have been easy for my husband to support some small marginal changes, claim victory, and then go on. But that's not the way he deals with tough problems, and this is an especially tough one that has many reasons for demanding our immediate attention. Yes, there are economic reasons for businesses, for struggling hospitals that need a stronger financial base that only universal coverage can provide, economic reasons for doctors who spend 40 to 50% of the income they bring in dealing with the unnecessary paperwork and regulation in a system that eats up money that should be spent providing health care instead. And it's economic when we think about the deficit at the federal, state, and local level that needs to be brought down by bringing health care costs under control. It's also, though, a matter of social justice. That is something that needs to be talked about more in our country. It is not right for the richest country and the greatest democracy in the history of the world to stand behind other countries with fewer resources and shorter democratic traditions when it comes to providing health care. Every American should be entitled to have his or her health care needs met. There are also political reasons. We want to make our government work again. We want to have the government on the side of people. We want to put people first. We want to show that a president and a Congress can actually solve the problems of real Americans and not just get mired in gridlock like we have too often in the past. But there is also a moral and ethical imperative. What kind of country are we? What kind of people are we? What kind of lives do we lead that give testimony to our deepest beliefs if we don't show caring and compassion for every one of us? As I sat in that hearing room earlier today, listening to the heroic stories of mothers and fathers who want to care for their chronically ill and often severely disabled children at home, I thought about all of the rhetoric we've heard about family values over the last years. In fact, there are those who are opposing health care today, claiming to do so in the name of family values. I was with real family values today. I was with the mothers and the fathers who are doing what we want families to do without very much help and support from the rest of us, and often against a system that makes it extremely difficult to do what they know is their obligation and responsibility. I want to stand with all of you at the end of this year and know that we have fulfilled our responsibility to each other, that we have made our country a better place, and that we have recognized we are all interdependent, all of us. And if we do that by making sure health care is affordable and of high quality for every American, we will have given new life to the kind of America we want to be part of building. Thank you all very much.
Mrs. Clinton, we are set up, we're using the technical, the superhighway, if you will, to try and do a few tricks today. We are prepared here to respond with computer machines to any questions that you may want to ask to check the opinions of this particular group that's been so supportive of health reform. Probably we should do one or two of those, and then that we want to entertain some questions from the audience, which Kevin Fickenshire will moderate.
Well, this is a new experience for me, Steve. Thanks for giving me this opportunity. I've never had a chance to be so high-tech before. Let me ask first if the audience there agrees with the President's pledge that any bill which does not guarantee every American the right to health care should not be signed into law. That, in other words, universal coverage is the real bottom line for true health care reform in America.
Great. Okay, Ken Fleck is our computer expert.
And we need to have the computer system turned on for those of you in the back.
Okay. It'll take us just a couple of seconds to tally the votes, and you want to tell them quickly.
Statement that we're asking you to respond to, that Ms. Clinton asked you to respond to, is universal coverage should be the litmus test for successful health reform. Okay?
Is that yes or no? Or
no, this is five statements or five response from strongly agree, letter A, to strongly disagree for the letter E. Okay? And just wait 1 second here, and we're ready. Okay. Yeah, 15 seconds. Universal coverage should be.
Should we have the little song? Do 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 do. Are they voting yet?
Yeah.
Oh, okay.
Yeah.
Good. All right.
Yeah, 3 seconds. 2, 1.
Okay. Now we can probably go on.
There we go. Excellent. 61% of the audience strongly agrees with that statement. 25% agree with it, so you've got 86% of the audience on your side. 5% are uncertain, 5% disagree, 5% strongly disagree.
Great.
Very good.
Okay, our next question. Have you got another question you want?
Well, I do. This is very interesting. I would like to ask if the audience agrees that choice of doctor and health plan should be guaranteed as the choice of the individual, not of the employer or the insurance company.
Okay, choice of doctor should be guaranteed as a choice by the individual rather than by the company. That's the statement.
Okay.
Respond?
Now they have 15 seconds to respond,
Right.
and then we'll check this out. 6, 5, 4, 3, 2, 1. Okay.
There we go. Very successfully. 65% strongly agree with that statement. 23% agree. So you've got 88% agreeing that choice of physician should be a matter for the individual, not the company. 5% uncertain, 4% disagree, 3% strongly disagree.
Ken, you've done a wonderful job. We'd like to do more, but we want to keep on the timetable. Right. Kevin Fickenshire, you know Kevin. He worked with us in the White House, Mrs. Clinton. He's going to have some questions from the audience now.
Well, first of all, Mrs. Clinton, I want to thank you for your time and energies on behalf of healthcare reform. Your efforts are really making a difference for all of us who are very concerned about the future of the American healthcare system. Thank you for your efforts. I'd like to introduce Sister Jean Christensen. Sister Jean is a member of the board of directors for one of our long-term care facilities in Portland, Oregon. Sister Jean.
Good morning, Hillary. Thank you for being with us today. The facility in which I serve on the board, mission includes serving high-risk, frail elderly over the long term. Question, under the National Health Reform Plan, what is the commitment in principle and practice, i.e. programs and dollars, to this high-risk, frail population?
Sister Jean, thank you for asking that, because the President's plan is the only plan that outlines specifically what we believe should be done for the frail elderly and for Americans with disabilities who need special care. We want to provide more care options than are currently available, particularly by supporting home health programs and community-based programs. This is an important change in the way we have taken care of people in the past, because, as you know so well, because of your service, many families are put into the position of either bearing a great burden financially and emotionally in order to keep their older relatives at home, because the only alternative available is for their relative and the family to spend itself into poverty and then have access to a nursing home. What we believe is a much better, more dignified, and actually more cost-effective way to take care of people is by giving some financial support to home health aid, giving some support for respite care, giving support for adult daycare so that families are able to bring their loved ones to a facility during the day, moving from an adult daycare into a congregate housing kind of situation. So again, stopping short of the nursing home institutionalization. I have visited programs in several states that are model and experimental programs. I know that this will provide many more of our citizens with the care they need than the way we are currently doing it. And the President's plan would guarantee that we would start to make available services to our frail elderly in different settings and providing more continuing, seamless care as their needs increased, as opposed to the only alternative now being a nursing home.
Thank you.
I'd like to introduce John Koloski. John is a senior member of the corporate team at Des Moines, Iowa, a facility that you visited, and he's the Chief Financial Officer. John?
Good morning, Mrs. Clinton.
Good morning.
Under the President's bill, Medicare remains as a separate system, much like it operates today. Worse yet, Medicare is targeted for substantial cuts in payments to providers. Those reductions put those of us who serve a large number of the elderly at a substantial disadvantage. Why not take this opportunity to include Medicare in the total health reform package and effect true total system reform?
Well, thank you for that question. And let me start by saying we are not cutting Medicare. We are reducing the increase in Medicare payments for some services, but taking that money and using it to serve the Medicare eligible population by supporting prescription drug costs and long-term care options, such as I just discussed with Sister Jean. So the money is going to be kept within the Medicare system and used for services to Medicare eligible individuals. We believe this is an important change to make because even though Medicare will continue to increase in cost at about 6 to 9% even after these changes are made, we believe we can actually provide more services more cost effectively for citizens if we begin to provide these additional options. The second point I'd make is that many hospitals, as you point out, are dependent upon Medicare payments, and those payments are often less than what is available in the private sector, and they're often inadequate to help the hospitals bear the cost of uninsured care. Under universal coverage, every person would carry with him or her reimbursement. So many hospitals that have financially struggled under the existing system would find themselves much more financially secure and able to take care of patients because their entire funding base would be increased. Additionally, we are working to make more equitable Medicare reimbursement for a number of hospitals, particularly in rural areas or rural states, that have up until now not been reimbursed fairly. We think there ought to be a greater reimbursement going to such hospitals, and we will be designating hospitals as essential community providers where we know that in the absence of such a facility there would be an increase in the underserved even if they had universal coverage. So if you take all of those pieces of the President's plan together, and this is something that we have worked on very hard, we believe we will be stabilizing hospitals which up until now have not been able to be financially secure because of their population patient mix, and we will be using Medicare dollars more efficiently. And that's why we think that this will benefit hospitals and facilities such as yours.
Thank you. I'd like to introduce Dr. Frank Green. By the way, if you have time problems, you let us know, okay? Frank Green is a general surgeon in Red Bluff, California, which is one of our rural facilities. And he's not only a member of the medical staff, but he's also a member of the board of directors for our facility out in Red Bluff. Frank.
Thank you. My question is regarding the great disproportion of the medical care dollar being spent futilely in the last 1 or 2 months of life. I'd like to know how this is being addressed and what the thoughts are about it.
Thank you, Doctor. Well, one of the things we want to urge, and as part of this legislation try to do so, is that more patients use advanced directives and living wills like President Nixon did. It was a great blessing to his family that President Nixon had taken the time to set out clearly what his beliefs were with respect to extraordinary medical intervention in the last days or weeks of life. We really want every adult American to take seriously the opportunity to do that, and we try to provide more public education and perhaps even some incentives in health plans to encourage patients to do that. That, as much as anything, would make a very big difference because, as I'm sure you know, based on my many conversations with doctors around the country, oftentimes when a family is brought together at the end of an older relative's life in the face of a very difficult medical situation, in the absence of any clear direction, members of the family are at odds with one another. They don't know how to make the decision, and oftentimes maybe adult children who have been estranged or not close to the mother or the father come together, and the guilt and the terrible emotion of the moment make them assume such a responsibility that they don't want to accept, and they therefore do not want to make any difficult decision, which leaves doctors and hospitals in a very, very unfortunate position. So we think that would be a major help. And then the second thing is we really believe that as everyone is covered and as everyone knows that they will be guaranteed the health coverage they need, people will feel more secure making some of these hard decisions at the end of life, because we will not be discriminating against people on the basis of income. Right now, as many of you in that audience know, we ration health care on the basis of cost. Some people are given extraordinary measures at certain points in their lives, whereas others might not because of the cost considerations. These decisions should be made on medical bases and human moral bases, and we can actually begin to have that kind of conversation once everyone is secure that they will not be left out of the system, that their needs will be fairly considered and treated.
Thank you.
Sister Regina Marie Mybush is a nurse specialist who lives in Milwaukee and is a part of one of our rehabilitation hospitals there.
Good morning, Hillary. My questions involve several aspects. You're in touch with all the people on the Hill and perhaps can give us some sense of this. I know your husband has, presented a bill or proposal, and there are numerous other bills floating around that we're addressing. There are several aspects, and I'm wondering if you could give us a sense of where the points are that I will ask you about in order that we can exert more pressure where it needs to be. For instance, universal coverage, in terms of the various bills that are out there, what do you think is the coverage at this point?
Well, Sister, that's a very good question. There are only two bills that would guarantee universal coverage. The single payer bill that is supported by a number of members of Congress and the President's bill. There is no other bill that would guarantee universal coverage. They might, in the bill, say it is a goal or that they believe it can be achieved over a period of years, but they do not set out a plan for actually guaranteeing coverage for every American. So any of the other bills you hear about just do not achieve what we think is the most important goal, and that is guaranteeing coverage.
Perhaps I should tell you the other 3 points in one, and you can include them rather than taking so much time. The second point is in regard to long-term care. Where are we with that? And the third point is one, conscience clause, is one that I never hear discussed, and yet we talk about it a great deal in terms of those of us that have moral objections to the abortion question. And the fourth point is a uniform basic coverage package. So long-term care, the conscience clause, and a uniform basic coverage package. Where are these in the various bills?
The long-term care provisions that I discussed a few minutes ago with Sister Jean are in the President's bill. There is coverage for long-term care in the single-payer bill, but most of the other bills do not deal with long-term coverage at all. And I know of no other bill that sets out a plan for how we would actually create an alternative long-term care system in our country that would support families at home and provide community-based care. So there really, again, are not any bills that guarantee the kind of systematic reform in long-term care that we think our country needs. As to the conscience clause, that is a part of the President's plan. He feels very strongly about it. It would extend to individuals such as doctors and nurses, as well as to hospitals and to entire health plans, so that the conscience exemption would be there, and we think has to be part of any health care reform effort. And then the final point, and I'm told that this, I guess, is my final question, they're waving at me, is the uniform benefits package. Very important issue. The President's plan outlines what the benefits are. Being talked about in Congress do not do that. They take one of two approaches. Either they say, we will tell you later, after we set up a national board, what the benefits will be. So vote for reform, but in a sense, vote without knowing what you are getting, which I find a very hard concept to grasp. I wouldn't buy an insurance policy if I didn't know what I was buying, and I can't understand why some people think we should buy a legislative overhaul of the healthcare system without knowing what benefits we would be receiving. And the second approach is for some of the bills to say, well, we're going to leave it all up to the insurance market. We're going to make some insurance reforms, but then whatever you buy is up to you. And again, then, there would be no guarantee that every American would be entitled to a benefits package, which is what the President believes we ought to be talking about, so that if you live in Milwaukee or you live in Iowa or you live in Oregon, you are entitled to the same comprehensive benefits package. That's why we think it is very important for the Congress to tell the American people what health care reform by outlining what's in the benefits package, so that all of you who are healthcare professionals can judge it and know how to implement it, and where there are gaps, as there would have to be because we cannot provide everything we would like to, we would be able to buy additional coverage that would fit our particular personal needs, which we think is the way we should proceed.
Okay. Thank you very much, Hillary.
Thank you, sister.
Hillary, thank you very much for taking time from your busy schedule to join us. We really sincerely appreciate it, and thanks for your comments.
It is my pleasure, and thank all of you for what you're doing every day. Thank you.
Thank you.